I couldn't operate on her the same day, which I would have preferred because her blood count was so low from the blood loss that she had suffered during the operation.
Right.
So she had not received any blood post-operatively over 2 days. And so I transfused her with a couple of units of blood to get her up into a safe margin for surgery that we did on Saturday morning. And as I reflected during that period of time, it was helpful because I thought about it and I said, well, obviously there's going to be some issues arrive, legal issues, malpractice issues arrive from this case, just from seeing the x-rays and from interviewing the patient, who literally had almost no motion in her lower extremities. And so I decided to record the surgical procedure, video record, which was obviously audio and video, and which turned out to have been a very prudent thing to do because it was helped further along when we came to trial 5 years later, I think it was. And because it obviated any argument that, recollections by the experts were accurate, et cetera, et cetera. Well, this was however many colors are in the video,
Right.
Documentation with audio, with a date and timestamp on it.
Picture's worth 100 words, and a video is worth 100,000.
Yeah, exactly. So we did the surgery on Saturday morning. Got just cut through the skin, and immediately there was cerebrospinal fluid just flowing out of the wound.
Meaning that he had punctured into her spinal cord.
Yeah, it turned out he had torn the dura in 2 or 3 places, and had not repaired that. Made any attempt to repair that. And then as I explored further, and it was interesting because the cerebrospinal fluid was in there. There wasn't any blood. Cerebrospinal fluid kind of dissolves blood and washes it away, and rinses everything. And so everything's pretty pristine when you look in there. It's not stained with blood. So the videos turned out to be excellent as a result of that. And virtually anyone could differentiate between tissues. You didn't have to differentiate between shades of red and pink. So that was nice. We got in there, immediately saw the dural tears, saw the bottom screw on the right side, which was right through the spinal canal, and going right through the S1 nerve root on the right. And it was kind of just floating. It wasn't hardly attached to anything. There was a rod that was connecting the 2 screws together, but the rod hadn't been secured into the screw above, so it was providing no support, no structural support at all, just kind of rattling around.